Our hearts need blood to work. Blood brings the heart oxygen. This oxygen keeps the heart pumping. Sometimes the tubes that carry blood to the heart can get blocked. These tubes are called arteries. When arteries get blocked, it is called coronary artery disease. This disease is very serious. It can lead to chest pain. It can even cause a heart attack. Angioplasty is a procedure that can help. Doctors use it to open blocked arteries. This helps blood flow better to the heart. Angioplasty is minimally invasive. This means it doesn't need a big surgery. First, the doctor will numb a spot on your arm or groin. They will insert a small tube called a catheter. The catheter has a tiny balloon on the end. The doctor will carefully guide the catheter through your blood vessels. It goes all the way to the blocked artery in your heart. Next, the doctor inflates the balloon. This pushes the blockage aside and opens up the artery. Sometimes, a small metal tube called a stent is also placed in the artery. The stent helps keep the artery open after the procedure. Angioplasty can relieve chest pain. It can also improve heart function. This procedure can even save your life during a heart attack. However, like all medical procedures, there are some risks. There is a small chance of bleeding, infection, or damage to the artery. Most people recover quickly from angioplasty. They go home the next day and return to their normal activities soon after. Amaco Health Diagnostic Center uses the latest technology for angioplasty. Their expert team is dedicated to providing the best possible care. They are committed to helping patients live longer, healthier lives. At Amaco, you can trust that you are in good hands. The future is now.